When it comes to workplace violence and incivility, nurses are actually working in hospitals and other facilities that are disproportionately high risk for physical violence because of the nature of their job. To maintain a personal safety and an environment that's free from any type of potential physical violence, we need to be alert to any signs of trouble. Not all healthcare workplace violence is actually physical nature that's initiated by patients or their families. Like any other business, there's also the subject of horizontal violence and interdisciplinary incivility. Horizontal violence comes in a form of intimidating and behavior that are not very nice between and among staff, managers, and physicians. It actually starts to interfere with job performance and actually will have a negative effect on the delivery of high-quality patient care that we want to give. No organization can completely prevent or eliminate workplace violence, but they need to properly plan and come up with effective programs. And so that way, if violence does occur, we can hopefully dramatically reduce, the occurrence of it. Horizontal violence or lateral aggression are terms used to describe aggressive and destructive behavior of coworkers against each other. Other terms associated with this type is known also as bullying and interpersonal conflict. These behaviors exist in what is also known as areas known as toxic workplaces. Another term often used for incivility includes a wide range of behaviors, from ignoring to rolling one's eyes to yelling, and eventually personal attacks, both physical and psychological. When it comes to consequences, safety and quality of patient care are going to depend on teamwork, communication, and collaborative work environment that we've spoken about. To ensure the quality and to promote a culture of safety, healthcare organizations, they need to address the problem of behaviors that threaten the performance of that healthcare team. Intimidating and disruptive behaviors can cause accidents with preventable adverse outcomes. Psychological stress of incivility can come in many forms, can actually lower work performance, cause medical errors. It can contribute to poor patient satisfaction. All of these issues are related to incivility, can actually start to increase the cost of care, but they can also cause clinicians, administrators, and managers to actually go and seek other positions in a more professional environment. Workplace bullying is often reported to result in enough psychological distress to nurses to cause them to actually leave the profession. And these concerns are the main issue, and that's why there's an urgent need for prevention for both patient to nurse and nurse to patient and nurse to nurse violence. In a toxic workplace, dysfunctional attitudes and emotions seem to permeate the atmosphere. This phenomenon harms both the company and other employees, and over time, positively motivated employees start to drift away from the workplace, and only employees comfortable with the negative atmosphere remain on staff. Organizations who articulate a strong set of cultural values regarding communication, respect, and professionalism, as well as an evaluation system that ranks both technical performance and the professional treatment of fellow employees, are felt to be less likely to develop a toxic environment. In 2008, the Center for American Nurses published a position paper stating that there's no place in a professional practice environment for lateral violence and bullying among nurses or between healthcare professionals. These disruptive behaviors are toxic to the nursing profession and have a negative impact on retention of quality staff. Horizontal violence and bullying should never be considered normally related to socialization in nursing, nor should it be accepted in a professional relationship. The statement goes on to assert that all healthcare organizations should implement a zero tolerance policy related to disruptive behavior, including a professional code of conduct and educational and behavioral interventions to assist nurses in addressing any disruptive behavior. And as we see here, the Joint Commission also is going to be involved. In 2008, they revised its standards for disruptive behavior, calling for identification of manifestations of abuse and violence in healthcare organizations. One of the recommended policies is zero tolerance for intimidating and or disruptive behaviors, especially the most egregious instances of disruptive behaviors such as assault and other criminal acts. So organizations are encouraged to have interpersonal professional dialogue across a variety of forums as a proactive way of addressing ongoing conflicts, overcoming them, and moving forward through improved collaboration and communication. And this is continuing from the other slide. Some solutions to incivility. There's actually two approaches to dealing with incivility and the toxic workplaces that are created. One is from an organizational level. This includes primarily establishing specific behavioral values that address professional, courteous, and respectful interactions among all staff. Managers and supervisors and administrators should model professional, ethical behavior and foster an environment of mutual respect. Bullying or disruptive behavior must be addressed and closely tied to performance evaluation with clear descriptions of the consequences of non-adherence. This implementation must be a ground-up strategy that brings the front line and administration together. Your team strategies can be used to identify and take on incivility wherever it is. There needs to be training recognizing bullying behavior and conflict management that can help individuals create a zero tolerance environment for any type of bullying behavior. Individual assessment is related to how you as an individual deal with incivility or bullying is also very important. Do you ignore the bullying when it happens to others, or do you participate in incivility without really recognizing the results of your actions? Do you gossip about other staff members? And do you have feelings of superiority over other staff? Do you communicate with respect? These are some things that you want to look at and pay attention to. You've probably already maybe even seen some of this in your clinical rotations and preceptorships. Being part of an organizational team that works to establish a cultural form of civility can be an eye-opening experience. Such a team works to keep civil behavior reinforced as part of an everyday functioning. Being a member of this team can also teach skills on how to manage acts of incivility and provide provide the base to build stronger work teams. And we're going to discuss more of this in class.